Hello and welcome to Let's Talk About It, a podcast created by the FUSE, an outreach initiative within the College of Applied Studies and recorded on campus at the Elliott School of Communication here at Wichita State University. I am Bobby Berry, the director of the FUSE.
And I'm Jessica Newman, faculty member in the Elliott School of Communication. Welcome to Season 2 of Let's Talk About It. We are so grateful to have closed out such a successful first season, and we've got some great shows in store for you for Season 2. So in today's episode, we're going to be talking about college students and the aftermath of COVID-19.
Now, there's been so much happening at Wichita State, and we'd like to address this topic from several different vantage points. Our first guest is Camille Childers, Director of Student Health Services, and she's here to discuss the effects of the coronavirus and what it has had on our campus and how we, as a university, are moving forward together. So once again, welcome Camille to the podcast.
Thank you. Glad to be here.
Thank you so much for being here with us. Now, I know that very early on in the pandemic, the university put together a team of professionals to basically just develop and maintain a game plan to keep our campus safe. So
Right.
My question for you is, what's your overall role here at WSU, and then how have you been able to use that expertise to lead this charge on campus?
Okay. Well, my overall role is I'm a registered nurse and I work as a director of student health services. Basically, my role as a director is to provide leadership for the department, overall supervision and operational management for the department. I also serve on several campus committees and I work groups as basically the health services representative for the campus.
Okay.
So as a director, I'm also responsible for things like budget, planning, staffing, assessing our services, and evaluation of how we're doing and how the staff are doing.
So Camille, when COVID-19 initially was identified and labeled as a global pandemic, what were some of your first reactions and how did you think the virus would impact our campus community here?
Well, interestingly enough, part of the little-known facts about student health and what we do is we've always served a campus public health role. We've always done that kind of behind the scenes. We have been monitoring and tracking situations or disease conditions, not a pandemic per se, because we haven't had one for 100 years, but things like when MERS was active in the Middle East or Ebola in West Africa. Those were things that we had been monitoring and tracking. I also serve as chair of the health risk assessment team, which is part of our emergency operations plan. And that function of that team is to monitor and identify things that are going on globally, within our nation, within our state, and locally that could affect our campus population. So when we started looking at what was going on at Wuhan, China, where the COVID virus started, we were watching. We're watching and waiting to see, is this going to spread? Is it going to get worse? We live in a global society, so we need to watch what's going on in other countries, not only because we have a strong international student population, but because in this global world we live in, what's going on overseas will eventually affect what's going on in the U.S. and in Kansas. So when we start talking about the COVID virus, we had been looking at kind of watching what was going on. And it actually started to have some impact at WSU as early as January of 2020, even before cases were going on in Kansas. The first impact that we really started to see was the decision from the travel situation that came up regarding the CDC issued a recommendation to avoid non-essential travel to China in January 2020. That was the impetus for us to start meeting on campus to talk about what is the impact. And we chose at that point, Dr. Golden was here, we decided not to send students to China for study abroad. There were students scheduled in the summer and the fall to go overseas, so we canceled that program. So even though there was no COVID in the U.S., we were starting to look at what the impact on our campus would be that early. So when the pandemic was officially declared by the World Health Organization, we were already starting to meet on campus. The campus pandemic planning team was meeting. Different entities on campus were meeting to talk about how were we going to respond? What were we going to do? So early in March, you made me go back and look at all my appointments. I haven't kept a journal, but I have kept all my meeting dates. So early in March, the pandemic planning team began to meet and talk about the growing pandemic. As that group and then smaller work groups met, we started to decide what would be the best decisions possible for what would probably be one of the most challenging times we ever faced. So.
Wow, that's really, I don't know if you know that, Jess, but I mean, that was a lot for me because I didn't know that our institution, our university was actively engaged in, preparing us for things like this. So I appreciate you being here to at least shed some insight to that, because that's eye-opening for me as a person who's been on this campus for some time now.
Yeah.
So thank you for that.
Yeah, I think to all of us, it kind of felt like none of this started till March,
right?
Yeah. But to know that you all were working behind the scenes there and just preparing before we even knew we needed to be prepared, and it feels to me like that we as a university, under you all's leadership, have really come together to kind of combat the spread, and seems like generally we've done a pretty good job on this campus. So could you walk us through some of the measures that have been put in place to protect the WSU community?
Yeah, and that actually, the conversations on how to reopen the campus after the shutdown occurred within the state, which the governor of Kansas had a shutdown order, and that's when we closed campus in March and canceled spring break, then extended it, and then sent everybody home in March. Those discussions on what it would look like to reopen the campus actually started in April. So Dr. Golden formed 7 working groups that had representation from staff, faculty, and students. And there was health and safety, there was a classroom space conversation, curricular design, student finances, research, innovation partners, and then, of course, strategic communications. So we had these 7 working groups that had representation that was addressing specific issues related to how can we safely reopen campus in May. I think the May 26th date was a date that we scheduled to reopen in some form or fashion for summer. And then over the course of the following months, these groups met. Sometimes I'm on the health and safety group. Still currently that meeting is, and most of these groups are still active today. We were initially meeting almost every day to look at how can we do this? What can we do regarding best practices that are being put out by our federal, state, and local health departments? How can we apply what we knew at the time to what was going on, given that this was and continues to be a very fluid situation? So out of the health and safety group, the things we were discussing is what is our best practice and policy we're going to do on campus for face coverings? What are we going to do about physical distancing? What are we going to do about PPE? What about cleaning? All of these things, we had a very diverse team and we tackled these issues. And then all of those subgroups met together once or twice, once a week, sometimes twice a week, to kind of bring everything to the table. And we didn't set policy, we gave recommendations that then went to the administrative team to set the policies. So there's been hundreds of people working on this behind the scenes all along. We've looked at everything from going through classrooms and measuring spaces to designating how many students can fit safely in a classroom, given physical distancing. I mean, every little nuance that we talked about, and we were open to questions, suggestions. So there's been a ton of groundwork to get us to where we are.
I know even within our college, that was something that we did regularly. So we put together a pandemic response team that was kind of really as directive from our dean, and so we worked diligently to see what that would look like. And I think as an individual, a faculty member who was teaching in person in the fall and currently in the spring, I think that was very important for me to be able to have classrooms that were safe. So I appreciate the thought and the effort that went into what would that look like, because I think a lot of our students were longing to have that in-person experience. So definitely thank you for being a part of those efforts. So one of the things that I wanted to ask you next is, as a healthcare professional, what do you feel like your biggest challenge has been, with a lot of the things that have been going on lately?
Well, as a healthcare professional, probably my biggest challenge in everything related to COVID is that I guess we really can't, if you're a black and white person and you have to have a standard answer that applies to everything today, tomorrow, and the next month, this would be a very frustrating time for you. Yeah. You have to be very comfortable in living in a state of gray, and we've been doing that for well over a year. So I think the most frustrating thing for me was being able to walk people through the fact that I can answer that question today, but what I tell you today may not apply as early as tomorrow. It's just so variable. I mean, everything changed. We're dealing with, and we have been for a long time, we're dealing with a novel virus, which means we didn't know anything about it. And as we've learned, as people have gotten sick, as people have recovered, as the vaccine has been developed, it changes all the time. Even now, the information, the best practices, the recommendations, they change. So you have to be able to pivot quickly. You have to be able to operate in that state of gray. And you have to be able to offer support to others that are struggling with that. I think that variability has been a challenge. I'm okay with change. So for me, it wasn't that big of a challenge. I'm a nurse. We go in. When we look at a situation and I walk in and assess a patient, my first thought is, what's the worst thing this can be? And then I'll work up from there.
Yeah.
So that kind of thinking helped me. But sometimes it was, okay, I've answered this question 15 times today, but I'll answer it one more time. And just being patient and answering those questions and knowing that it's just so, we didn't know.
Yeah.
We just didn't know.
Yeah.
Yeah, living in a state of gray, like you said, is like, that rings very true for me for the past year. And I also feel like a lot of us, we look to healthcare professionals like yourself for information, but I think a lot of times we also look to you for reassurance. And so
Right.
sometimes it might be like, we know the answer to this, but like, we're going to keep asking you and maybe hope there's something different, and so I'm sure having to kind of be the PR team as well as the pandemic team has not been easy by any stretch. But I do think you guys have done a really great job on campus. And so I'm curious to know if you have any information on this. Do you know how our COVID numbers compare either to like the greater Sedgwick County area or other universities for that matter?
I think overall, what we see on campus on the percent positivity rate for COVID-19 is comparable to what we see in our local county. When we saw a spike here, it was the same time a spike was going on in the county. I think it's important to note that the data we collect on COVID-19 cases only reflects those that we're testing. There's a lot of students and employees and community members that they don't test through us.
Sure.
Oftentimes, if you're looking for what's going on in our community as a whole, I think the local numbers from Sedgwick County or KDHE are more informative of what that looks like. We only can report on what we know.
Right.
And if students are testing elsewhere or they're not reporting to us because we're not mandating that they report they have COVID, we can only report on what we know.
Okay.
Makes sense.
And so with that being said, kind of in closing, moving forward, do you feel that we as a campus community are adequately prepared to handle another spike if we see those, or maybe even another global pandemic? Do you feel like we're prepared for that?
I do. And, as I said, we have a fantastic team of extremely dedicated people that have put hours and hours and hours above their normal jobs to make sure that we're doing the best we can to provide a safe and healthy environment for everybody at WSU campus. I think that experience, even though it's only been 12 or so months, that experience we've learned so much from. We have a great network of resources through Student Health. We're kind of the point of contact for both the Kansas Department of Health and Environment, which is our state public health agency, and the Sedgwick County local health department. I think we have great connections there. We're tapped into them. We have partner calls with them, as a lot of agencies do once a week. And I think from that, we could handle definitely a spike in cases. We need to be able to be ready to pivot and adjust to that, but we've already done that, so we can fall back on what we know. As far as another pandemic, my sincerest hope is that we never have to do this again. It's like, but we have managed some pandemic-like situations before, never to this extent or scope, but the Campus Health Center responded to the H1N1 pandemic. And we also worked with students coming from the Middle East, again for MERS, and we were part of responding to the Ebola epidemic when that occurred, because we had individuals coming from that area of the country. So we were already working with our health department for Ebola back when that occurred. So we have some ground here. So if we needed to, we would do what we have to do.
Well, I'm glad you're here. I know I am
Thank
glad you are here.
Yes, I'm glad you're here on campus, and I also am really glad that you spent some time with us today. So thank you. We really appreciate that you being here. And before we let you go, could you just tell our listeners where they can get the most up-to-date information on COVID-19?
I think because we're under the umbrella of Kansas Department of Health and Environment, they have a great website related both to COVID-19 and then to vaccine. We are in the midst of creating some FAQs about vaccine. You may have heard that we have become a vaccine provider, and we will be assisting with our campus students and staff and employees to get the COVID vaccine under the umbrella of the Sedgwick County Health Department. We have to follow their guidelines. So we are creating some FAQs for that. Student Health has a great website. We do work with the Strategic Communications to keep our COVID-19 website at WSU update, so that information is current as well. So look at your local health department and WSU's websites for the most accurate information. Don't go to Google.
Great advice.
Once again, thank you so much for being here. And now we're going to switch gears a little bit to the topic of COVID-19 and the vaccine as well. So we waited for so long for these vaccines to be rolled out, and now they're here, and many factors are coming into consideration, from the distribution of the shots to the safety and the side effects related to them. And so here to hopefully demystify some of those things is Tasha Parker, a therapist and a doctoral candidate at Wichita State University. So welcome to the podcast, Tasha.
Thank you for having me.
Yeah, anytime. So tell us a little bit about yourself, what you do, and what are you involved with in and off campus?
So on campus, I am a second-year doctoral student in the community psychology program. I also teach a class as part of being in the psych department. I'm in private practice. I've been doing that for about 10 years, providing therapy and consultation. All types of different things.
So changing lives every day is pretty much what you're saying.
Right?
I'm trying.
So as a healthcare professional, can you tell us a little bit about how COVID impacted you and the work that you do?
I think for me, in regards when it first happened, that transition wasn't too difficult because I had a system already in place that I was doing some telehealth. And so it was literally just a click of the button, switch everybody over to
great.
telehealth. However, more people were struggling,
Sure.
And it was becoming more and more intense because all the changes. A lot of us distract socially, and to have to be in the house on top of the uncertainty of it, that increased a lot of people's anxiety. But it's interesting, some people who had a certain type of anxiety, they're like, oh, I knew this was coming. And so they're like, oh, I was prepared.
Like doomsday preppers?
Yeah, like someone was like, oh, I knew it. But the intensity and the severity of some of the issues that people were having, and like the influx, like so many people wanting to get into services now. Like I think last week I had like 5 intakes.
Wow.
And that's maybe in a month or
Right.
6 weeks, typically, you'll get that many new patients. But
Sounds kind of overwhelming.
yeah, it can be at times,
Yeah.
being at school and then trying to help people navigate through their personal lives, and then on top of the pandemic, but then you're also navigating it. And so it's that, trying to find that balance.
It's a lot.
So with that being said, I mean, a lot of your work is done, being able to look people in their eyes, being able to look at body language, being able to have that in-person ability to help process heavy emotions. Did that change for you, when you went to being more remote in telehealth? Did it take away the impact that you felt like you were making with some of those people who you're used to seeing all the time?
Yeah, it was different because, so I specialize in trauma, so I do a lot of integrative trauma work, whether it's EMDR, hypnotherapy, and so those things couldn't take place. Like you can do some EMDR online, but it's still difficult, and so you've seen those clients really, really struggle. And in regards to it takes a lot more energy. In my personal opinion, I have to be more on it Like, it takes a lot more energy to engage with somebody over telehealth, that platform. And it takes a lot to keep them engaged. Because they're at home walking around. I mean, I've seen some things. I've seen some things, you know, that I didn't think I'll see.
So when you heard about the vaccine and the way in which the county was going to distribute them, and it was announced that you were part of phase 1 by the profession that you do, and that you were eligible for the vaccine, how did you feel about that? What went through your mind that you're going to be able to be one of the first group of folks to be able to get that? What was that like for you?
I mean, it was exciting for the simple fact that often as therapists, particularly me being trained as a social worker, we're kind of forgotten about. And for a long time, no one considered us healthcare workers. But NASW did a lot of advocating to get us qualified to be able to get the vaccine. So there was a sigh of relief in regards to, okay, I can start getting back into the office to do some of that integrative care for those clients who need that. And so it was kind of, you know, I guess I wasn't too anxious about it. I mean, I definitely know what COVID was going to do. I knew the worst case scenario there.
Well, and kind of going along with that, you said you weren't too anxious about the vaccine in general. And there are, you know, a number of people that are cautious about it or just kind of wary of it for different reasons. Would you say that you had any reservations at all about the safety of it or anything like that?
I mean, I think definitely. I mean, I thought about it when you look at, I mean, just as a Black person looking at the history of medical testing, that's always in the back of my mind. But ultimately, I feel like I had to make a decision. It's like we definitely know what COVID was doing.
Right.
Like, I have a lot of clients who are nurses, and like that trauma that they're experiencing, like, I know what that was. I know how sick people were. And so it's like, well, whatever can come, the side effects of the vaccine, it may not be this. And so I'll take my chances here. And so
that makes sense.
Speaking of, you know, the vaccine and the symptoms and side effects, how did you respond when you got that initial shot? I mean, I know you personally, so I kind of know what that process was like, but tell our listeners, what was that like for you?
So I'm a little dramatic, so let me qualify that just a little bit. And so the first shot, like, first of all, that process was so quick. Like, there was really no time to change your mind because you were in and they were shifting you off. But I remember by the end of the first day, my arm really hurt, and that was most of it. My arm hurt, I had a headache, and I never torn a rotator cuff, but that is what it felt like. Like, you see me. I just knew, it was like, this cannot be right. Once again, I'm dramatic, so.
I was getting text messages from Tasha. Tasha was like, Bobby, I can't lift my arm. I'm like, okay, well, that's to be expected. It's a shot, Tasha. She's like, this is not right.
I mean, it was all about this shoulder pain for me. The first shot, that was the worst thing for me. And then when I came and got my second round, I waited forever, like over an hour to get in there. Like, it was a lot. Anyways, and so after that one, I had a little more symptoms. I took Tylenol this time, so my arm didn't hurt as bad. But by the end of that day, I think I was running like a low-grade fever. It's 99. That's not a fever, but to a dramatic person, it is.
Well, sure.
It's like, I may need to go to the hospital. I had a headache, a little pain in my chest, and so...
Heart attack.
Yeah, well, I called my doctor. I said, I think I got COVID. I said, I need to go. I need to come get tested. And he goes, well, you know, I really don't think. I said, you got to test me. And so I got tested. It was negative.
That's too good.
But the second shot knocked me down a little bit more, a little more fatigue, but it didn't last long. And at the end of the day, from what I understand, if you feel those, it's working.
Right.
And so,
yeah. So now that you have been vaccinated, would you say you navigate your world or your life any differently than you did prior to vaccination?
A little bit in regards to, like, I may be a little more open to going out to dinner. And I'm going to increase the days I'm going into the office so I can start doing some of that trauma work with people. But, you know, being a full-time grad student and a business owner, like, I don't have much time to do much anyway.
Yeah, I bet.
So once again, as we kind of round out this conversation, I'm happy we were at least able to shed some light from Camille's perspective on what our campus is doing, have a little bit of fun with Tasha, and in a topic that has been very heavy over the last year. So any final words of encouragement for maybe those who are hesitant to receive the COVID vaccine? Because there's a lot of people that I've heard that say, I don't want to get it, I don't trust it, I want everybody else to get it first so I can see what it does. I have friends that say, I'm only going to get the first shot, I'm not getting the second one. So any final words for those folks?
Well, I think fear makes us do things that we may not typically do, particularly when we are not acknowledging it and stepping into it so we can figure out how to move with it so we can make intentional, healthy decisions. And so my best advice is for people, acknowledge the fear, but step into it and move with it. There's always a chance of anything to happen at any time. But I think to be able to sit with that and choose accordingly, I have to acknowledge the fear about it. Yes, there's a possibility that you could get, true side effects from the vaccine, but there's also a possibility that you won't.
Right.
And people say, well, maybe I won't get COVID. Well, maybe you will. Right. Maybe you'll die. So, I'm going to take this chance over here. And so I think the best advice is step into the fear. That's what you have to do. Step into the fear, move with it.
And as Camille said, don't do Google.
Oh,
don't Google
please
stuff.
don't.
Ask questions. It's really important to make sure that you're getting your information from people who are doing this work and have been doing this work.
Yes, there's so much misinformation.
Absolutely.
Yes.
I mean, I had, at one point in time, I had a client asking me, like, so do you feel it? Like, no, I don't feel anything. Like, what chip? There's no chip. Like, I don't know what you're talking about. Like, it was like, people were like, I can't believe you.
Can you tell you're being tracked now?
Yeah, when I talk on my phone.
Right, exactly.
That's always been happening.
I think talk to the people who know and acknowledge that I'm afraid. It's okay to be afraid.
Yeah, absolutely.
Yeah.
Just acknowledge it.
Awesome. Well, thank you so much. We really, really appreciate you being here.
Thank you for having me.
All right, for the last portion of our podcast, we have an opportunity to learn about something that neither Bobby or I have actually ever experienced. So today we have David Nevarez and Chase Biswell, and both of these guys are WSU students, and they've actually had COVID-19. So let me start by saying that we are incredibly thankful that both of you have recovered from the virus, and also thank you for being willing to come on and talk about your experience. Not everybody would probably be as open, as you guys are, so we really appreciate that.
So really quickly, we want to at least get to know you guys a little bit better. So David, if you can tell us your major and exactly what standing are you here at Wichita State?
So I'm David. I'm studying aerospace engineering. I'm in my sophomore year now.
All right. Excellent. Sophomore. And Chase, what about you?
I'm a psychology pre-med student with a sport management minor, and I'm a sophomore as well.
Oh, 2 sophomores, all right. So if you can tell us a little bit about your stories, I'm actually going to start with you, David. So kind of, when did you become positive? Let's just start there.
Okay, so I was one of the first people that I knew around my age that got coronavirus. It was actually a couple days before June 1st, and I specifically remember this day because that was the day I was starting my internship at Evergy. So a couple days before that, my brother and his girlfriend and friend, we went out to the park just to walk, just to get some sun. And as soon as I got home, I started to feel a little nauseous. I started to feel a headache. I wasn't feeling too good. And that was a couple days before June 1st. And then the next day, I started to feel very bad. And then eventually I found out that it was COVID. So it was around June 1st, a couple days before, and then during my first weeks in the internship.
Now, during that time, were you taking precautions as far as guidelines were considered to reduce your risk? So how are you kind of maneuvering at that point in time?
Right. So at my house, I live with both of my grandparents. They're older than 65, and then I also live with my mother in Kansas City. And I wasn't too scared for myself, but I was taking precautions. I was taking all of the things that I could do for my grandparents.
Yeah.
I didn't want the virus to come into my house. I know that my grandfather, he had some health issues during that time. And I just didn't want to intervene with that. I didn't want them to get sick, to go to the hospital, and then eventually something worse. So I was taking precautions when I was going out just to buy groceries or to do the essential stuff. I would always have my mask, of course. I would social distance. I would always have the hand sanitizer in my car. I was very cautious about it because of my grandparents.
Mm-hmm.
And unfortunately, even though I took all of those precautions, I still got sick.
Sometimes just happens anyways.
Right.
So you mentioned some of the symptoms that you had. How long duration wise was your illness?
I think it was the symptoms overall. It was around 3 weeks.
Oh,
So
wow.
I did start with feeling. I felt like I had some type of food poisoning. Just those symptoms of food poisoning. I wasn't feeling too good, headache, and then like I mentioned, the day after the park, I started to get a fever too. So my fever went up to I think 104, 105.
Wow.
It was pretty
Oh my
high.
gosh.
I felt bad. And at the moment, my first idea wasn't, it's coronavirus, because I felt like it was something related with just food poisoning, since I was
Sure.
taking precautions. I was being careful. I didn't go to large gatherings or anything. But yeah, during that 1-2 days, I had a very high fever. My mom took care of me while my grandparents, I told them to just stay away. And then I started off with that. And then the next symptoms that I've experienced was actually on June 1st. It was orientation with my internship. I had to go pick up equipment, laptop, all of those things. And then when I got back home, logged into the meetings, I started to notice that my grandma's breakfast, her eggs, and they were just tasting very salty, which was very uncommon.
Right.
Because I'm very familiar with my grandmother's recipes, with the breakfast that she usually makes, and it was very salty. And then on that same day, since it was an internship, a virtual internship, my manager from Topeka actually ordered some food for lunch so that we could all eat lunch together, get to know each other. And the hamburger was also very salty. And I was like, what's going on? I'm usually not a picky eater. I eat anything, honestly. Anything. But my grandma's cooking, and then the hamburger my manager ordered for me was very salty. So I started to feel a little bit weird.
That's so interesting.
That is very
I've heard about
interesting.
people losing
Yeah.
taste.
Right.
I haven't necessarily heard about it just kind of changing, although I guess that makes sense. The same things would come into play there.
But yeah, I had both actually. It started off with things just starting to taste very salty. And then if we fast forward 2-3 days ahead, I just lost my sense of taste and smell. Started off with a strawberry. I just ate a strawberry, and it tasted like plain solid water.
Weird.
It was just water.
Yeah.
I couldn't taste anything, nothing sweet, nothing sour, nothing of a strawberry. It just tasted like water. And then just to test out, do some little experiments on myself, I grabbed my cologne. I sniffed it, and nothing.
Wow.
Something that smells very strong, cologne, deodorant, stuff like that. Nothing.
Goodness.
It was very
Wow.
weird.
I remember talking to you,
Right.
while you were sick. I remember speaking to you, and you sounded like you were having a very hard time. You just sounded so exhausted, and you sounded very different than the David I'm used to hearing. So, and I remember us having a discussion about some of those, but I didn't know the extreme of some of the things that you were dealing with during that time.
So, mentally and kind of academically, I mean, this hit in the summer for you, but you did mention the internship. In terms of just mentally and emotionally, and then also in terms of your internship and academics, how would you say this virus impacted your life?
So yeah, during the summer, I was involved in a couple things. So I actually had 2 summer classes, just English and public speaking, but then I also had the internship, and I was also taking a course to get my remote pilot license, since in my internship we flew drones just to inspect different power lines in Kansas and in Missouri. So I was pretty busy during that time.
Yeah, you had a lot going on.
Yeah, I had to study for my classes and then also had to study for that license and then the internship. There was a lot going on top of trying to keep my grandparents away from me. Yeah. So emotionally, it sucked because I kind of took it seriously of just being in my room for almost 2 weeks.
Wow.
Just my room and the restroom. That was it. And I couldn't leave the house, of course. I couldn't go to the kitchen. I couldn't go to the living room with my grandparents. And it was kind of hard, honestly, since I live in a very small home. And as soon as you open the door of my room, there's a kitchen. So as soon as I had to use a restroom, I would yell out or message my grandparents like, "Oh, I'm about to head out. Don't be around."
Yeah.
Wow.
And then another thing that they did is they set a little table outside my room and they would leave food. And it was a little weird. It was like I was in my little prison. But I did really take it to the extreme just because of them, because they're 66 now, and I just didn't want the virus to affect them at all. And that was just what I was doing. I woke up, ate, internship, classes, homework, public speaking, record myself. Actually, for one of the public speaking videos, I talked about my experience about being in the lockdown. And it was a pretty cool story to tell now and then something in the future because it was unique. And now we go to more academically. My classes weren't too bad. They were the basic requirement classes.
Sure.
There were a lot of assignments. There was some reading, but it wasn't too difficult. I think I did okay with that. I was able to get by with that.
That's great.
Now, thankfully, and hopefully, so were your grandparents were they okay? Did they ever?
Yeah, another story. So after I recovered, about a month later, my grandfather had to get surgery. So like I would mention, he was dealing with some health problems. But before the surgery, he had to get tested. And he tested positive. And I don't think it was because it was a month after I was all good. And I'm not sure where it came from. It probably was whenever they did go out. They didn't go out too often, but whenever they did, my grandfather probably got it there. I'm not sure where it came from, but I don't think it was because of me because it was a month later before my symptoms ended too.
So was he asymptomatic, or did he end up getting symptoms after being tested?
So yeah, he tested positive, and I think first it affected him mentally.
Sure.
Because he was
scary.
Yeah, it was scary for him, and he was starting to say like, "Oh, my body hurts," and and just those symptoms that I feel sick. But then actually we started to notice that he was kind of shortness of breath. Mm-hmm. But thankfully, thanks to God, it wasn't too extreme.
Good.
He had that pressure on his chest, but that was it. He didn't need to go to the hospital. I think 3-4 weeks later, he got the surgery. All went good. My grandmother also got it since they live with each other. But honestly, the symptoms that hit the hardest were towards me. I got the strongest symptoms. My grandparents, their symptoms were light. Honestly, they were just tired. My grandfather, shortness of breath, and my grandmother, I think just tired. Yeah, I got the worst of them all.
Silver lining there that you're young and healthy, so it's kind of good, I suppose.
Yeah, for sure. Mm-hmm.
Well, let's switch over to Chase. We've kind of gotten one full story of how COVID could impact somebody's world. So I'm very curious to hear how your story kind of compares and contrasts to David. So will you just kind of walk us through what went on?
Yeah, so I went home for Christmas. I'm from a small town up by Topeka. And when I came back like the 1st of the year, 1st of January, and that's when I started to feel sick. And I'm from a small town that they're anti-maskers. They don't believe in masks.
Gotcha.
And so nobody wore a mask. I mean, I did, of course, because I've been around more the college life, and people care for one another down here more than they do up there, to be real honest. And so I wore the mask, and I was like, picked on pretty much, voodoo to wear a mask. But
That's too bad.
It is really sad, too, because people have gotten sick up there.
Sure.
But anyways, so I came back, and I'm sure I got it from there. I live by myself, so I'm lucky that nobody else had to be affected by it. So I started to feel symptoms like the third of the year, I think. And so I went into the doctor because I thought I had strep throat. I'm very prone to strep throat. My throat was just killing me. And so I went in and got tested for strep throat, and they said it was negative, and they wanted to test me for COVID too. I wasn't lucky enough to have one of those rapid tests, so my test took 3 to 4 days to get a result. So I had to quarantine. Well, I was going to quarantine anyways. I was like tired as can be. I slept like 36 of 48 hours or something like that. So I was just exhausted. So I had no problem with waiting to get my result back. But they told me that I had COVID. Like I tested Monday and they told me Friday or something like that. And so I felt really sick for about 3 days probably. And I thought it was strep. I was like dead set it was strep throat.
Yeah.
I got a fever. Again, I slept a lot. My muscles ached completely. It was horrible. I couldn't get up, to be real honest with you. I think I lost about 10 pounds in that week.
Whoa.
Yeah, it was
incredible.
really bad. Some people would be like, yeah, I lost weight, but no. It was not a good weight to lose.
Not a healthy way to do that.
But, so I felt sick for about that 5 to 6 days, and then I stayed quarantined like you should for the 10 days. I think I even did 2 weeks, but the worst part of it after the fact was when I got over the sickness was my mental health was horrible because I didn't see a soul for a week when I was fully recovered pretty much. So that was horrible because I'm more of a social butterfly and I wanted to see people, but I care about you, so I'm not going to ask you to come hang out.
Right. Just lonely.
Yeah. I watched, I went through 3 or 4 TV series. It was a lot of fun.
So we'll have to get some, suggestions on
Oh,
what
my
shows
goodness.
to watch from you.
Well, Friends is a great choice.
Well, sure.
A lot of episodes too.
Yeah, right.
And I think that's one of the things that, especially that you bring up, Chase, is just the layered impact of this virus. Not only the physical aspect of it, but the mental, the emotional, and just once again the way in which it impacts so many people so differently. And I think that's one thing that maybe that we've seen a lot, especially after the last year. And when in our first season, we had someone that came on and talked about just the whole the social and the psychological aspect of wellness and things of that nature. But I think sometimes it's not till that virus impacts you directly that you see a lot of those things that maybe you were able to avoid by being social or, just being busy all the time. And I think it's sometimes in those moments you're like, whoa, you had that moment of being able to pause. But we definitely thank you for sharing at least that part with us. And we know it hasn't been easy, but when we think about, returning to campus, and so, came back in the fall, were you guys leery at all about returning to campus? Were you nervous? What would that look like? How would that be? Did you think because you're both sophomores, so coming out of your freshman year and having a semi-normal, for the most part, and then were you nervous about things being different?
Well, and this will be interesting because coming in the fall, you had COVID and you had not yet, right?
Okay. Yeah.
I'm curious.
Well, for me, I think I just, if we're talking about virtual learning, the semester before that, it sucked, honestly. Just working at home, being able to go do groceries with my grandparents, do the basic chores, but then also trying to focus in my small house. I was actually excited to come back to campus in the aspect of having a library, having my own room to study. But I know that since a lot of people from a lot of different cities, a lot of different states were coming to one place, sharing the same dining hall, the same buildings, the same tables, everything, all the school supplies here, I knew that there was a likelihood that cases were going to rise eventually, even though we were masked, social distance. Yes, that minimized it, but it was prone to happen just since everybody came from everywhere. And I was nervous more for my partner and for my friends since they weren't the ones that had gotten sick before. I was fine with me because I had already experienced it. I already knew what it was, but those other friends, they had not. So I was a little bit more nervous for them.
Yeah. What about you, Chase?
Yeah, coming in the fall, I wasn't worried about myself getting it because I knew I could probably beat it, which sounds really bad, but
I know what you mean.
Because I know some people aren't as lucky and well off as I am in terms of physical health. I was more worried about getting it and then going home and giving it to my grandparents, like David was saying earlier, or my parents, or my mom's a cancer survivor, stuff like that.
Wow.
So I was more worried about that. So I didn't even go home the first semester, but 2 times, I think, which I'm a homebody. I love going home. So that was what I was worried about most. And when I got it and came back in the spring, it's not that I'm not afraid of it still, but it's more on my mind that literally anybody can have it at any time.
Yeah.
And people need to be more wary of it. Yeah.
So this part is interesting to me because I know coming back, even some people did not come back. There was a lot of students who did not return to campus. There was a lot of faculty who chose to do purely online or remote. So what was that impact like for you guys? Or did you guys even have in-person classes at that time? Were they primarily online when we came back in the fall? What was that experience like for you, Chase?
So I'm a very learner in person.
Yeah.
In-person learner. I don't know how to say it, but I didn't have a class in person from March of 2020 until this semester, which was really hard on me being a pre-med student. So I even have taken a step back from my pre-med courses because I couldn't learn online. I took biology 2 in the fall, or tried to, and I had to withdraw because I wasn't learning anything. So that's been really hard on me academically. But yeah, I finally have an in-person class with you, Bobby, and it's really fun.
Oh, look at that.
It's 8 a.m. on Tuesdays, which is worse because I'm not a morning person. But, I would do anything to go back to in-person right now.
Yeah.
And I wish people were more, I guess, empathetic and caring that we would get this virus behind us.
Yeah, absolutely. Yeah. And speaking of having the virus behind you, you both have recovered, but I'm very curious to know, we've heard a lot about long-term implications and kind of just lasting side effects. Do either of you, and I guess we'll start with you, David, and then move over to Chase, do you have any lasting symptoms that you've encountered?
So right now, no, but around my first semester of my sophomore year, I started to notice that just my sense of smell was a little bit weird. So when I would go into a new building, you know how it has that building smell, or just when you go outside, it smells like outside. Right. Just those strong smells. For me, it smelled like rubber, like a tire for some. Yeah, when I first got that smell, and it was a little hard to adjust. One time I was just driving and I opened the window on a beautiful day and it smelled like tires, rubber. It was a weird feeling, but I don't have that anymore. My sense of smell is good now, but I did have that for about 2-3 months actually.
Wow. That's interesting.
Mm-hmm. Yeah.
What about you?
I was lucky enough not to lose my taste or smell. But I think the thing that I noticed was right when I was getting over it, I never had problems with my breathing until afterwards. So I like to run, I like to go to the gym and stuff like that, but I really felt heavy in the chest for probably until about the middle of February. My breathing was just a little weird.
And that would have been like 6 weeks.
Yeah. And again, it didn't happen until after I got over it, and then all of a sudden it came back. But I think the thing that really I'm struggling with still to this day is emotionally. I feel like I'm not in the right state of mind still from it. I'm a really avid believer in sharing physical health with people. I mean, mental health. I mean, physical health, sure. But mental health is important to me, and I'm still struggling mentally because of it. I feel overwhelmed in life, and I'm pretty sure it's because of COVID. I felt pretty good beforehand, and now that it's happened, I don't feel the same.
Yeah.
And I think it's interesting because, I mean, we've been in this pandemic for a year at this point, if not more. And I think the fact that everyone's really had to adjust, you can't go out the way we used to. We can't hang out with friends the way we used to. We can't live life so liberally, if you will, as we used to. So I think that aspect is very important. I think that's something that the after effect of that is we're going to deal with for a very long time, even when this virus is quote unquote past us, if you will. And so really we want to say first, thank you guys for sharing your perspective, and we're so glad that you guys are here. You're able to be with us today. You're feeling better. But one of the things I would like to at least end on is if you had to give a message and share a message with the students regarding how to stay safe and why it's important for them to do so, what is one thing that each of you would leave with our students that are listening today? David, we'll start with you.
I would just say if you haven't gotten it, or if you haven't lived the coronavirus life like Chase and I have, then I would say think about those people who are at risk. I know a couple weeks ago we hit 500,000 deaths. I personally know 2 people who have passed away due to coronavirus, and those things should motivate you to just simply wear the mask, simply be careful in large crowds, just listen to the scientists who are now have the vaccine. Take those precautions, inform yourself, and just really sympathize with those people. Really try to get into their shoes, see how life was for them this past year. It probably wasn't as bad for you. Maybe the worst thing for you was not seeing your friends, or maybe not being able to have classes. I know those things suck a lot, and it sucked for a lot of students, for myself, but some people have had to deal with death, and just think about that when you're going about your day.
Perspective, I appreciate that. What about you, Chase?
I think you hit it right on the nail, but I think everybody's in college right now, and they want to go to that party. They want to live the college life. They're not going to let COVID stop them from doing that. And I'm not going to stop them from doing that either, no matter what I say. You just have to care about people. Is that party really worth going to if your grandparents are going to get sick because you went to it and got COVID and spread it to everybody? I don't think the answer is a yes there. So I think just thinking about others. If you're sick, stay home. Live to see another day and help another person live to see another day too.
Very well said. Excellent. Well, again, we just really want to thank you guys for being open and honest with us, and being willing to come and talk about kind of a vulnerable topic. We really appreciate that. And also, thank you to all of our listeners for tuning in to our first episode in Season 2. We really do appreciate your support. And as always, we'd love to hear from you. So leave us a comment. Let us know what's on your mind. And if you are someone who's been keeping up with us for a while now and you find value in what you're hearing, just do us a favor and share this podcast with your friends. So thanks for tuning in. Have a good one. And join us next time on Let's Talk About It. Bye.
Bye.